This is Jess, the nurse of the future. She is making a profound impact on healthcare, both in facilities and in the community as a primary care nurse. Let's talk a little more about the problem Jess is working on. Jess is working to help Americans with their healthcare problems. What are those problems exactly? The top 4 most common causes of death in the United States in 2010 were heart disease, cancer, chronic respiratory diseases, and cerebrovascular diseases. Each of these illnesses come with a slew of medications, non-pharmacological treatments, lifestyle changes, inpatient therapies, and of course, more medication to combat the unwanted side effects from all of the previous medications. How is Jess going to possibly have the time to treat those chronic, deadly illnesses? The nurse of the present in primary care is often underutilized and not working up to his or her full scope of practice. However, research has shown positive patient outcomes when nurses are integrated in primary care settings. Research has found that when nurses are involved in primary care settings, patients report higher rates of satisfaction, higher rates of compliance with medications and treatments, and increased knowledge of both their condition and their treatment plan. Nurses are in a unique position to greatly benefit community health as a whole through healthcare. Jess, the nurse of the future, cares for patients in an individualized, preventative, and innovative manner unprecedented in healthcare. As a primary care nurse, Jess considers each patient's family history, genetic profile, and individual risk factors to develop an optimal healthcare plan. Patient-centered care is the focus of our healthcare plan. Jess interacts with the other essential members of the healthcare team, including nutritionists, physical therapists, physicians, and pharmacists to develop a plan that prevents or halts the progression of these serious chronic illnesses. Let's take a look at how each of these illnesses can be prevented. Healthy eating and physical activity can prevent heart disease. The nurse of the future will play an active role in teaching these tactics to patients and encouraging that they develop a healthy lifestyle early in their lifetime. According to the Mayo Clinic, there are simple steps you can take to prevent cancer. These include cutting out tobacco, eating a healthy diet, maintenance of healthy weight, physical activity, protecting yourself from the sun, getting immunized, avoiding risky behaviors, and getting regular medical care. Avoiding exposure to tobacco smoke, avoiding home and workplace air pollutants, and avoiding respiratory infections can prevent chronic respiratory diseases like COPD. Incorporating some lifestyle modifications can significantly reduce a person's risk of developing cerebrovascular diseases. Some examples include maintaining a healthy weight, maintaining a healthy diet, ensuring adequate exercise measures, quitting smoking or continuing to abstain from smoking, drinking alcohol only in moderation, and properly managing stress. Maybe you notice there are many lifestyle changes that overlap among multiple prevention strategies. Healthy eating, eliminating smoking, maintaining a healthy weight, and exercising reduce a person's risk of developing heart disease, cancer, and cerebrovascular diseases. Why then do these diseases remain so prevalent and deadly? The nurse of the future will focus on addressing this question. There are many different factors that need to be considered when determining human behavior. Lack of healthy food options, resources, time, and education can all contribute to an individual's diet, exercise, and lifestyle choices. A community-based primary care nurse is in a particularly good place to identify the factors that affect his or her health choices and help create plans tailored to their individual situation. A key differentiation of Jess's plan is preventing illness before it begins by teaching healthy people how to avoid illness. Jess's multifactorial plan includes educating her patients on risk factors and teaching them how to minimize their risk through diet, exercise, and lifestyle changes. Jess will also use the patient's genetic profile to help shape his or her health care. For example, a patient who carries a gene conducive to developing breast cancer may be placed on a diet and fitness program that helps prevent cancer from developing. Jess is also more involved in the community than ever before, participating in community events such as school functions, parades, and festivals. As community members begin to see Jess as a neighbor, they will be more likely to seek her out earlier when they begin to experience symptoms that may indicate a progressive disease. Early detection and treatment can make a monumental difference in recovery and survival rates for many illnesses. Additionally, Jess is part of a nursing community that works with the education system to provide more health education in schools. This will provide a better basic health understanding, as well as connect students with resources they can use in the future to help maintain their health. An additional resource that will assist Jess in healthcare promotion is the use of technology. In the future, healthcare will develop an inclusive, integrative cell phone app that is easy for anyone to use. This app will include various disciplines: nursing, nutrition, medicine, physical therapy, occupational therapy, public health, and more. Jess will be able to update the patients she cares for on health alerts, changing technologies, new medications, and research related to their particular situation. The app will also be accessible by the other disciplines, which will provide an optimal multidisciplinary approach to healthcare. An example of the benefit of this app's notification system would be a local health alert for the drinking water in a particular community. Jess, or another member of the healthcare team, could send out a notification as soon as the water warning was initiated. Here's an example of the individualized care this app could provide. Meet Sam, a patient at the clinic Jess works at. Sam has type 2 diabetes. He regularly takes his blood sugar, and his blood glucose monitor links automatically to the app, is then uploaded to the software that the healthcare team can view in the office. While reviewing Sam's data, Jess notices some fluctuations in Sam's blood sugar. She sends him a notification regarding these fluctuations and suggests diet alterations that may correct the problem. After a few weeks, Jess checks back on Sam's blood glucose levels. She notices that the problem remains, so she decides to alert him, requesting that he make an appointment at the primary care clinic to be seen. Sam then uses the app to schedule himself an appointment at the clinic to be evaluated. The app would also provide multiple opportunities for quality improvement. Jess and her healthcare team can track patient health data and assess which health interventions provided a positive impact and which did not. As a clinical nurse leader, this data would provide exceptional opportunities to collect patient health information, analyze trends, implement procedures, and study the results of such interventions. The nurse of the future is working towards better health care through community-based, prevention-focused, individualized health plans. She will be a critical member of the primary care team. Her impact will help reduce the prevalence of preventable diseases in the United States and increase the overall health of communities everywhere. Thank you.